have been two studies this week, one from the World Health Organization, which suggests that countries with high levels of air pollution should ramp up their coronavirus preparations. Those with underlying pollution-related conditions have developed severe COVID-19. Medical professionals say it's too easy to prove a direct relationship. Dr. Robin Russell-Jones is scientific advisor to the All-Party Parliamentary Group on air pollution. Thanks for coming on, Robin. Where are you on this? To what extent those who have had the effects of severe pollution being overrepresented in COVID-19 victims?
Well, the evidence appears to be quite compelling. I mean, we know from studies in China that there are certain conditions that predispose sufferers to dying from COVID-19, obviously pre-existing lung disease, but also cardiovascular disease, history of strokes, hypertension, or diabetes. These are all risk factors for COVID-19. But of course, those same things are also all caused by air pollution. So then the question is, how much of the association between these pre-existing conditions is actually due to air pollution? So is air pollution making people more susceptible to dying from COVID-19? So the Harvard Public School of Health looked at this in America. They already had extensive pollution data available from all areas of the states. And they looked at then the data on mortality that was being gathered by Johns Hopkins, and they correlated the two, and they showed there was a very strong relationship between your chances of dying from COVID-19 and the levels of pollution. The pollutant they particularly looked at was small particulates, which we know are the most dangerous of the various pollutants to which people are exposed.
And that's diesel fuel.
Well, diesel is a major contributor. It's not just diesel fuel, but it's certainly one of them. And they showed that for every increase in PM 2.5 of 1 microgram per cubic metre of air, your chances of dying from COVID-19 went up by 15%. So if you compare someone living in the country, in the UK, with a sort of level of 8 or 9 micrograms per cubic metre, and you compare them with people living in cities such as London with levels of 13, then the London dwellers are sort of 60-70% more likely to die if they get COVID-19 than people who live in the country.
So how do you kind of maximise the opportunity here, which sounds unnecessarily cynical, because we can feel the air is better. If you live in a city, you can feel the air is cleaner, yet you can't help thinking that we'll kind of forget this as the need to get things going again prevails in a year's time, and we're able to, or whenever it might be, before long we'll be back to where we were.
Well, I think the one thing that we learned from previous crises is not to go straight back to business as usual. And it would, of course, be tragic if we did go straight back to business as usual, because lockdown has given us a vision of what an unpolluted world can feel like and look like. I mean, we can hear the birds, we can see the stars, and we can breathe clean air. So the task for society is how to achieve that same freedom from pollution without crashing the economy. And of course, that's where government intervention is so important. I mean, if we're going to bail out industries that have been badly affected, then we need to do it with strings attached. Particularly things like the aviation industry. I mean, they're all asking for huge handouts. But if they're going to get government support, then it should be on certain conditions, that they, invest in greener fuels, that they allow VAT on airline fuel. They don't encourage what's called binge flying, where people sort of fly to East Europe, for a stag weekend. There should be some conditions on the way that we restart the economy, and there should be strings on how we support these industries.
What can you explain to us on a slightly different matter about vitamin D supplements? PHE is telling us to consider taking daily vitamin D supplements throughout the spring and summer. Where are you on this? I mean, generally and specific to the time of the virus.
Well, we know that vitamin D is protective against coronaviruses because they've done study with vitamin D supplementation. It reduces the number of colds you get every year. So we do know it's protective against coronaviruses. We don't know specifically whether it's protective against COVID-19 because the studies haven't been done, but it's sort of reasonable to assume that it might be. You then have to look at the fact that people in the BAME community seem to be suffering more greatly from COVID-19 than other ethnic groups. And of course, one of the things that distinguishes people in the BAME community from Caucasians and so on is the fact that they have dark skin and vitamin D is produced by sun exposure. And people from the ethnic minorities, BAME communities, have lower levels of vitamin D, particularly towards the end of the winter when they've had very little sun exposure. So that might be one of the explanations why people in the BAME community seem to be suffering more. There are other possibilities. I mean, air pollution is also a possibility because a lot of people in BAME community, particularly in London, live in areas that are very congested and highly polluted. So that might be another factor.
And on dosage, it's quite difficult to get your head around what's required because the dosage is expressed with a peculiar symbol. It doesn't just say grams. It's got some peculiar symbol on it denoting dosage. So what is the daily supplement?
Oh, that's a good question. I think it depends if you want to replenish your supplies or if you want just to maintain your levels. There are vitamin D supplements that you can buy over the counter. Vitamin D3 to 3,000 units a day is usually sufficient to maintain your levels, but you might need a higher dose if you wanted to replenish your levels.
Okay. Robin, thanks very much indeed for coming on. That's Robin Russell-Jones, Scientific Advisor to the All-Party Parliamentary Group on Air Pollution.